Well, welcome back, everyone. You know, it is American Heart Month, and today we have Dr. Hemraj Makwana from the LMHS Heart and Vascular Institute here to talk about a common heart condition called PFO, or Patent Foramen Ovale. I believe I said that right. Did I say that right?
Right. Perfect.
Yeah, all right. Well, thanks for joining us, doctor. So what exactly is this, and how does it affect someone's overall heart health?
So I have to talk a little bit about the anatomy of the heart. So heart has 4 chambers, and upper 2 chambers, they have a tiny connection, and that is called foramen ovale. Now, we all had it. Before we were born and we were in mom's belly, we all had that hole in the heart between 2 upper chambers of the heart, so the body can get proper circulation. So that was normal. When you're born, you don't need that anymore. So that hole with upper 2 chambers of the heart should close. If it does not close and stays open, that is called patent foramen ovale. So it's not a hole in the heart like somebody puncture your heart, but basically it's a connection between 2 upper chambers of the heart. Now, let me add one more thing. You don't have to panic when somebody says you have a PFO or patent foramen ovale, because if you take random 4 people from the street, 1 will have a PFO. So it's a common condition. 25% population has it. So it should not alarm you unless you have some medical conditions, and especially stroke. So if you have a stroke, and especially younger generation, and if you don't find any other cause causing stroke, most probably hole in the heart or PFO is responsible for that. So yes, PFO is a benign condition, but young people with the stroke most probably caused by this hole in the heart or PFO.
Very interesting. So PFO, that's kind of like the cause of a stroke. So is that when medical attention is actually needed for PFO?
Yes. That's what I was trying to say, that PFO, it means if you go to your doctor and somebody said you have PFO, you should be careful, but you don't need any treatment at that time. PFO is important only for the patient, young patient with a stroke, and we don't find any other cause for stroke, then definitely we have to look for PFO. And in that condition, you have to see a heart doctor, and we do a simple test called echocardiogram with the bubble study, where we inject micro bubbles and do echocardiogram. And if you see the bubble crossing from one chamber of the heart to other chamber of the heart, we know that this patient has PFO.
Okay, so what treatment options are available then?
So years ago, when we did not have enough data and evidence about what to do with this, we used to just treat with medicines. But in the last 10 years, we have enough evidence suggesting there needs to be closed or repaired to prevent the second stroke. So most 99% of the time, we can fix it with minimal invasive surgery. Basically, we make a tiny hole in the groin like IV, and through that IV we can put a tiny device all the way up to the heart and plug the hole in the heart. It's an outpatient procedure. Patient can go home same day or next day morning, and it is fixable without surgery.
Huh, very interesting. So you can assess the PFO is actually the cause of someone's symptoms?
Most of the symptoms, as I said, stroke symptoms. Mini stroke symptoms or stroke symptoms, we look for the PFO, basically.
Okay, fantastic. So for those that might be concerned about their heart health, or maybe some ongoing symptoms, or even family history, they can actually schedule a same-day appointment at Lima Memorial, right?
Definitely. You can call the number on the screen and give us a call, and we'll get you in, and appropriately, whatever questions you will answer and take care of it.
All right, well, fantastic. Dr. Makwana, thank you so much for joining us today. Appreciate it.
Thank you. Thanks for inviting me.
All right, well, don't go away because we have more when we return.